How does seroconversion affect STI test accuracy? Imagine getting tested for HIV after a possible exposure and wondering if your results are truly accurate. Seroconversion is a key process that can influence how reliable your test results are, especially in the early stages of infection. When someone is infected with a virus like HIV, their immune system begins to produce specific antibodies to fight it. This process, called seroconversion, marks the body's response to the infection. During this time, the amount of antibodies or viral components in the blood is still low, which can make detection tricky. The period between exposure and when the body produces enough antibodies or antigens to be detected is called the seroconversion window period. For HIV, this window can last from about 1 to 12 weeks, depending on the type of test used. Fourth-generation HIV tests, which detect both antibodies and viral antigens, are more sensitive during this window than older tests that only look for antibodies. However, even these advanced tests can sometimes produce false negative results if performed too early. This means that a person might be infected but still test negative because their body hasn't yet produced enough detectable markers. It's important to understand that seroconversion mainly affects HIV testing. Other sexually transmitted infections like chlamydia, gonorrhea, or syphilis are diagnosed using different methods, such as nucleic acid amplification tests, which detect the bacteria's genetic material. These tests are not influenced by seroconversion because they don't rely on the body's antibody response. Once these infections are established, the tests are generally accurate regardless of the immune response timing. Practically speaking, if you think you've been exposed to HIV, it's best to wait at least 7 weeks before getting tested with a laboratory-based fourth-generation test. Some rapid tests might require waiting up to 12 weeks for accurate results. If your initial test is reactive, a follow-up confirmatory test is necessary to verify the diagnosis, as false positives can occur due to the high sensitivity of screening tests. Regular testing and screening are vital, especially if you have multiple partners or engage in unprotected sex, to catch infections early and start treatment promptly. In summary, seroconversion can temporarily hide an HIV infection during the window period, making early testing less reliable. Being aware of this timing and consulting healthcare professionals for guidance ensures you get the most accurate results. Remember, individual responses vary, and medical advice tailored to your situation is always the best course. Always seek professional medical help for testing and interpretation of results, and stay informed with trusted sources like the Centers for Disease Control and World Health Organization.